make them green, resilient, and inclusive.
Hello, everyone, and welcome to this panel hosted by the International Finance Corporation, the IFC, the private sector arm of the World Bank Group. We're delighted to see so many of you connected from across the globe. And big thanks also to our partners, the State Secretariat for Economic Affairs of Switzerland and the Ministry of Economy and Finance of Korea. My name is Aurélie Chardon, and I lead the cities business for IFC in Asia Pacific. The session today will be discussing how mayors can leverage technology to improve urban services, making them more flexible, more responsive, and more resilient. We will hear from groundbreaking entrepreneurs and tech providers on how cities can attract new solutions, build partnership to embrace more innovation, but also to ensure that the expected results are there and delivering. But first, let me hand over to Alfonso Garcia Mora, IFC's Regional Vice President for Asia Pacific, for a few words of introduction.
Let me start with the big picture and big numbers. I think that we all know that cities matter. And cities matter because they are a huge drivers of growth. Actually, they generate over 80% of the global GDP. But they face many challenges linked to the rapid urbanization and challenges that have been exacerbated with the consequences of COVID-19. Problems such as increase in urban population, pollution, lack of access to opportunities, and inadequate infrastructure require new technologies and ideas that are scalable, inclusive, and sustainable. We need to leverage technology to put cities on the grid, as we say in the World Bank Group. This grid is the new strategic framework of the World Bank Group that stands for green, resilient, and inclusive development.
Welcome back. So now, without further ado, let me introduce our distinguished panelists. First, we'll go to India, where Dr. Sabahat Azim has kindly agreed to join us. He's the founder and CEO of Glocal Healthcare Systems and of UpHealth. Dr. Azim is a trained medical doctor and has served in various positions in the Indian government. He founded Glocal Healthcare Systems in 2010 as a social venture that seeks to bring state-of-the-art healthcare to the rural population in India through an integrated model of block-level comprehensive primary and secondary care hospitals, digital dispensaries, and technology. The company now operates 11 hospitals in India and over 250 digital dispensaries.
So let's, I guess, move to India very quickly. Sabahat, Glocal Healthcare Systems and UpHealth is a provider of digitally enabled healthcare that makes healthcare access to the rural poor of India at a fifth of the fees of a hospital with similar infrastructure. These numbers are too good to be true. How does it work, and what hurdles do you have to overcome to set up Glocal and UpHealth?
Thank you, Isabel. Thank you so much. I'll try and break down my response into two pieces. One is the systemic side, and one is what we really do. So first of all, let me begin by a very old quote by Tennyson: "Old order changeth, yielding place to new, lest one good custom should corrupt the world." With a world of 7.7 billion people living, you simply can't do things the older way. And as cities grow and they have millions and millions of people packed into one place, it is simply not possible to have the old model of having, hospitals and then people just flocking to the hospitals, ambulances running around traffic, and then trying to find out how with sirens you can move them faster, how you can get them all into one place. And post-pandemic, of course, I think all of us have a realization that things are not working. Things are not working, and we need to get something newer, and that's what we exactly are doing. Glocal and UpHealth, we just listed on the New York Stock Exchange on the 10th of June, creating, in our opinion, the only comprehensive global digital healthcare company. And we begin from a plain telephone backed with an AI-based telemedicine system, with video conferencing connects, with personal health monitors for patients in their homes, to digital clinics, which are your equivalent of health ATMs, to pre-engineered hospitals, which can take care of increasing loads and are agile in terms of being able to increase the size and capacity massively. So what we actually are trying to do is that healthcare needs a transformation. We cannot have the older systems of people just flocking to hospitals trying to find out where to get. As cities grow, we need people to be able to access their own healthcare, be participants in their own healthcare, and it is a brave new world which encompasses not just rich media streaming on digital platforms. It is about AI making better decisions. It's about Internet of Things being able to collect patient data. It's about analytics in coming up with what is needed in a place. So we have a tool called Syntranet that allows population health to manage what is going on where, to interpretation. As cities grow and become more and more cosmopolitan, you would have people speaking different languages, and you need them to be interpreted between the doctor and the patient immediately. You need point of care technologies. You cannot wait for 4 hours, 8 hours to get a test result back. You need it instantly. Automation to deliver medicines immediately. And maybe, in the brave new world, you would have drones probably in the future delivering even faster than cars, and riders can do that. So the second part, which I would mention briefly, is where this is actually productization of healthcare, where you believe that healthcare is a basic human right and everybody must have access. It's not just for the rich. It's not for the 30% of your city or 50% of your city, because do not ask for whom the bell tolls, it tolls for thee. If there is a pandemic, if there's an infection in any part of your city, is going to spread everywhere and everybody is going to be affected. So you need to manage the healthcare of everyone. And that is exactly, when you productize healthcare, you automatically bring the costs down. When you bring the cost down, you remove the overheads, make it much more efficient. So we are today able to provide in India primary healthcare, complete episode with consultation, investigation, examination, and medication at less than $4. Uh, one hospitalization at about $500 at an average. And this is achieved by a host of technologies bringing in efficiencies by productizing every part of the supply chain of delivering healthcare. And unless and until we productize healthcare, cities would collapse because the cost of delivering healthcare will become so huge. In US, it's already 17% of the GDP, and that's not a cost that the communities in the countries can afford. So we partner with governments, with municipal bodies, with other large healthcare providers to ensure that it works seamlessly across all the sectors, from primary care, secondary care, tertiary care, provide analytics, and provide the supply chain and technologies behind to make it all work. That's what we do. And it's been a very, very interesting journey. And we are now in 12 countries across the globe and hope to be in 150 countries in the next few years. Thank you.
Really, people-centered development is forcing cities and governments to view infrastructure as a service, right? Where we no longer provide the physical, social, or infrastructure asset, but we really make mobility or health the core service that we need to deliver. Thank you so much. Sulfur, let me go back to you. Same question. We need to rethink how we live in cities. Will technology be the key to implement this new vision, and how? And what is missing, in your opinion, to make it happen?
Yeah, I think it's a resounding yes, right? Just as the way we are doing this conference, if not for the pandemic, we would have been physically there.
Thank you. Very good. Sabahat, let's go back to you. Over the last couple of days, we heard that mayors have to do more with less. That is at least the expectation of their constituencies, their citizens. We, of course, all of us think that leveraging technology is part of the solution. One way through, for example, transparent procurement rules incentives, like here in Singapore, could also contribute to the solution. Which other ways do you think mayors could think about to incentivize technopreneurs like yourselves and technology companies to really come in, invest, and drastically improve services? Anything else that you can think of that we could encourage cities and governments to think of?
So, Isabel, you have raised some very important points, and I would like to step back on the procurement before I answer this, because this is going to be the biggest challenge. Public authorities, when they procure, and when you are change, so I would differ with Jacob on one point, that It's not that pandemic, because of that we are meeting. I think with a population of 7.7 billion people, this was inevitable. I think pandemic has been a catalyst for very positive change in many aspects, which has happened. Similarly, the other issue and challenge with innovation and public goods is how do you procure those? And it is not as simple as having transparent procurement goals, because we are still thinking old world, that here is the government or the state and this is a vendor who's providing services. And IFC has also been in the forefront of finding solutions to how procurement can happen for a public good, whether it is by a public-private partnership, whether it is by a Swiss challenge. I think the largest challenge would be the agility and the openness in how do you procure innovation when you may not have a similar yardstick existing elsewhere. At the same time, being a public good, how do mayors and cities and governments and municipal corporations, how do they allow more participants to share in it? So the first challenge I think would be to find innovation which cannot be used like a standard tendering process or a bidding process. Second is how do you build in other people's interests, more providers' interest, and I think that would be by insisting on all procurements should be interoperable, use standards at the same time allow other people to hop onto platforms. So we will have to evolve, and I think there are no 100% answers, neither can we give, but the way forward seems to be by building Swiss challenge kind of patterns which can be put up in scale, but as a condition of public procurement, the same any innovative solution should allow not monopolies but allow other people to provide services or through the same platform, and that will come through interoperability and standardization. And the third thing is how do cities cope with changing things and paradigms that happen very rapidly, growing populations. So agility in terms of every infrastructure that you build in, open sourcing it, creating standards for interconnect and data privacy are things which are very, very critical. And these are very serious issues. And probably a lot more than technology would be how do we change the way we do business? How do we make it more open, faster, interoperable, standards based, and allow more competition to hop onto every product that you buy? And that's the real engagement. And I think that's where all of us have to work together to find a solution. It'll be a brave new world, but that's what we need to achieve.
Thank you, Sabahat. Lai, I want to give you the opportunity to get back, given that I think Sabahat has a different point of view. I think in his opinion, the first point that he made, the pandemic was actually the catalyst and has been a catalyst. Would you like to briefly elaborate on your initial point?
Well, I mean, I absolutely agree with what Sabahat was saying, that we are living in the age of disruption, and the pandemic is one part of the disruption we are seeing. And so it means also that we have to adapt and we have to change. So, and as the world is changing completely, we are changing our personal life, right? I mean, we used to, you go to school, then you go to work, and your brain is used to that you are going to work then you have to go to the office. Now things after 20 years, things are completely changed. So you have to adapt yourself, and everybody has to adapt itself. So in my recommendation also is that the government has to adapt themselves as well with regards to regulation, with regards to new business model. We are learning a lot when it comes to this digitalization and new business model. And I think that's why it's not possible for government and for cities to also to look into that topic, and then to also to try to adapt and to modify the way of we have done business. And as also Sabahat was saying, that the population is growing and the urbanization is continued to drive the growth of the city. So it will be even more and more complex. And I think we can't just, can continue the way we have done in the last decades or centuries. We have to also, I think, adapt and also allow new aspect of doing and servicing the people of the cities as well.
Thank you. One last question, but very I'm looking for very brief answers from all of you. So we've noticed that mobile applications for residents and visitors in cities are really keeping people well informed. They help them manage daily activities, from planning trips to choosing schools, etc. And the smart solutions, as Alfonso was mentioning in his introduction, we see them very much embedded in urban infrastructure. Everything from the different technologies that you have described. What do you think is the biggest challenge that cities are facing to implement and manage open data programs where they're going to be having access to quite a lot of personal and not personal data generated by smart technologies? And what is the role that potentially a company like yours could play? Sabahat or Sulfur, do you want to comment on that challenge about open data?
Yeah, Isabel, I would say that what we need to, very short answer, we need to move out even beyond GDPR and HIPAA to beyond blockchains to really think about paradigms like the zero knowledge proof. See, it's today we need to, and that's what we've also been working on. I think we all need to move out from the paradigm that I will collect all the data of the people and then work hard to put security guards, physical or virtual, to protect it. We have to find out ways with teeming populations how we do not impinge in the privacy of the teeming millions in our cities or in our countries. Only take temporarily the data that is required to make a decision and let the knowledge reside and the information reside with the person or the citizen who owns it. So we need a complete mindset thinking from command and control to respecting the individual but still getting our work done. And zero knowledge proof is one of the paradigms that can help make that happen.
Make them green, resilient, and inclusive.